New disturbing numbers tonight of the deadly flu outbreak. The CDC now reporting 16 more children have died across the country, bringing the nationwide number of child flu-related deaths to 53. NBC4's Tyler Carter joining us now live with more on what some people here are calling it the killer flu.
Yes, you know, Mark, as the flu spreads this season, doctors are saying this year's strain is the most severe in decades, and getting the flu this year can be a matter of life and death. This year's flu season is fierce, with at least 40 reported deaths in the state, according to health officials. The Ohio Department of Health says there has been more than 8,600 influenza-associated hospitalizations this flu season alone. Doctors say the number of people infected with the flu seems to be high because not everyone goes to the doctor when they are sick.
We're seeing a little bit of a decline, I would say, over the last week or two, in total numbers of people come in with the flu. But there's still a lot.
The big question many are asking is, how can someone die from influenza?
The flu virus can get deep in your lungs. Your immune responds and produces mucus and fluids. But what happens then? Other bacteria can grow and develop and cause pneumonia.
Dr. Glenn Williams, medical director of urgent care for Ohio Health, says children under the age of 5 and adults over the age of 65 are most at risk.
Other people, that bacteria will get into the bloodstream and cause something called sepsis and go to all your organs in your body, and that can also cause you to die.
Doctors are not taking the flu season lightly because they are treating so many people with the flu. Nurses and doctors are taking extra precautions to avoid getting sick.
We know our enemy. We're washing hands all the time. We're trying to stay away from it as much as we can, but sometimes it's inevitable.
And this is Tamiflu. It's often prescribed by doctors when you get the flu to help treat it, but some pharmacies across Ohio, they are seeing a shortage of it because so many people do have the flu. So if this is your case, first doctors say, make sure you talk to your pharmacist first to find out your options. You can take Tylenol, and most importantly, make sure you stay hydrated. If you do have a severe case of the flu, make sure you visit your local ER. Local for you in Columbus tonight, I'm Tyler Carter for NBC4.
Tyler, thank you. A nurse in Northeast Ohio is out of a job after she says she was too sick to work. And she says the hospital she worked for fired her after she became sick. THERESA PUCKETT called out sick once at the end of 2017. When she came back, she was sent home early because she was still sick. University Hospitals has a policy that temporary nurses like her may be dismissed after 2 non-approved absences over 60 days. THERESA says this speaks to the nursing and hospital culture, keeping hospitals staffed no matter the consequences.
And I was punished for that. I was punished for staying home with a doctor's note. I thought, this is a larger problem. This is larger than myself.
UH has a no-fault attendance policy where the hospital says doctors' notes do not excuse an occurrence of absence. They say their attendance policy for fill-in nurses is similar to policies at other hospitals.